Hepatitis B. Introduction. Most babies who are infected with the hepatitis B virus cannot get rid of it and will develop chronic hepatitis B. Select true or false. Correct. About 90% of babies who get infected develop chronic hepatitis B. That is why babies and children should be vaccinated for hepatitis B. What type of infection does a person have if the hepatitis B virus stays in the blood more than 6 months after infection? Choose one of the following options. 1. Acute hepatitis B. 2. Chronic hepatitis B. Correct. If the blood still tests positive for the hepatitis B virus 6 months after the infection, the person has chronic hepatitis B. Which of the following is true about people who manage to get rid of the hepatitis B virus after being infected? Choose one of the following options. 1. They are still contagious. 2. They are immune to future hepatitis B infections. 3. They still need to be vaccinated. Correct. People who manage to get rid of the hepatitis B virus after being infected are immune to future hepatitis B infections. They cannot get the infection again. Most people feel sick when they become infected with hepatitis B. Select true or false. Correct. Most people feel healthy and do not know they have been infected. Which of the following is not a way that hepatitis B is transmitted? Choose one of the following options. 1. Sharing razors with an infected person. 2. Breathing air in the same room as an infected person. 3. Having unprotected sex with an infected person. Correct. Hepatitis B is not transmitted casually. It cannot be spread through breathing the same air as an infected person. Which of the following categories of people can be helped by the hepatitis B vaccine? Choose one of the following options. 1. People who have not been infected with the hepatitis B virus. 2. People who had acute hepatitis B but are now immune to the virus. 3. People who have chronic hepatitis B. Correct. Most people with chronic hepatitis B can expect to live a long and healthy